I'm Dr. Hemanth Kumar, Consultant Surgical Gastroenterology and HPB Surgery at Manipal Hospital, Old Airport Road, Bangalore. Today we will discuss about one of the common clinical condition which we see in our surgical practice, that's gastroesophageal reflux disease, or what we call as a GERD. This clinical condition has become very common in our clinical practice, mainly because it is one of the very common lifestyle disorder which we see, especially in younger population, mainly because of the eating habits, lack of physical activity and sedentary lifestyle. When do we suspect that the patient has gastroesophageal reflux disease is depending upon the symptoms. Most of the patients will be obese, they experience regurgitation of food whatever they eat, they have increased acidity and bloating, and very rarely a persistent nocturnal cough can also be the reason. If someone experiences these kind of symptoms, we suspect them to have gastroesophageal reflux disease and then subject them to certain investigations to confirm the diagnosis. Coming to the investigations for gastroesophageal reflux disease, we usually do an upper GI endoscopy, which will tell us, which gives us a lot of information about the strength of the lower esophageal sphincter or any damage has been induced because of the reflux like Barrett's esophagus or esophagitis, and also at times bacterial infections like H. pylori can be picked up. And the second investigation, the gold standard investigation to diagnose GERD is 24-hour pH monitoring, where we place multiple probes inside the esophagus and stomach and monitor the patient over a period of 24 hours to see the reflex episodes in his supine, while sleeping, while standing, all those things, and we have a scoring system, and depending upon that we diagnose gastroesophageal reflux disease. Once the patient is confirmed that has GERD, there are different treatment options which are available depending upon the severity of the symptoms. In the dietary and lifestyle changes, we advise them to eat meals at proper time intervals, to avoid spicy, oil, deep fried foods and also citric foods, and quit smoking, alcohol, as these trigger these reflex episodes. These are the dietary and lifestyle changes we advise in all patients of GERD. And the medical management, we usually start them on proton pump inhibitors and also medicines to prevent the reflux. In mild cases, most of the patients with the dietary lifestyle changes and the medications, they subside and they get cured. But in complex cases, especially when they are associated with hiatal hernia, we advise them to undergo surgical procedure. Coming to the surgical procedure, we do what we call as a Nissen's 360-degree floppy fundoplication, where we are trying to create a artificial valve using the stomach to prevent the reflux episode, in addition to repairing any hiatal hernia the patient has.